Hi, do you have stiffness in your neck, back or knee? Do you work in an office chair for long hours? Now, working as a physiotherapist for the past 7 years, I've seen clients from all walks of life, and they always complain the same thing to me. They always complain of stiffness in the back when they wake up in the morning. They complain of stiffness or even pain on the knee when they try to walk after sitting a long period of time. Some even have to limp when they wake up in the morning for the first few steps because they have pain on their heel. So when you don't move for a long period of time, the circulations in the joint become stagnant and inflammatory waste accumulates in the joint. When you want to move again, you'll feel stiff or even pain. But once you start moving, the circulation improves and you will feel much better. Usually, the body will self-recover after some time with simple remedies. But if you realize that it is not getting better after some time, you should get professional medical attention. Here at the Pain Relief Practice, we recommend using our signature radio frequency treatment to facilitate with your healing process. Radio frequency therapy helps in two ways. First, it stimulates faster healing process by increasing your cell metabolism. Second, it provides deep heat that reaches into the joint to increase the blood flow and nutrients to reduce inflammation. We have over a decade of clinical experience, validated by international clients in multiple clinics in Singapore, Surabaya, and Jakarta. Our proven track record allows us the confidence to speed up your recovery process and help you achieve your treatment goals faster. If you would like to find out more, simply give us a call right now.
大家好，我是乒乓球队的于梦雨。
I'm Wong Xingru, a national table tennis paddler for Team Singapore.
一般我们受伤的部位有背部，然后颈项、肩膀，还有膝盖、手腕。
Some of us suffer from tennis elbow and back injuries. It cannot help us with the intensity of our training if we suffer from such injuries.
非常感谢 Pain Relief 的帮助吧，然后每次去的时候，都会有专门的物理治疗师帮我们放松肌肉，然后也帮我们做一些理疗。
By having Pain Relief providing us with physiotherapy services will help us to keep up with the intensity of our training and competitions to help us perform better. Hi, I'm Wong Xingru, a national paddler for Team Singapore, and I'll see you in the next video.
Hi, welcome back to the Pain Relief Practice. So today, we are here to talk about other types of pain relief treatments that we provide for our patients. So the first type of treatment is the partner-assisted stretching. So the physiotherapist will do an assessment and analyze which muscles are tighter than usual. The benefits of stretching is to improve joint range of movement, blood flow, reduce muscle tension, improve muscle coordination, and reduce the risk of injuries and soreness before and after activities. The second kind of treatment is to use percussion therapy with the use of a massage gun. Percussion therapy uses rapid pulsing effects to bring faster relief deep into targeted muscles. The treatment also releases trigger points and softens muscle tissues with increased stiffness. The benefits of percussion therapy increases blood flow, removes lactic acid buildup after a tough workout. This will work in tandem with stretching to relieve muscle soreness and pain. The last type of treatment is the kinesiotaping. Kinesiotaping helps to alleviate pain and facilitate lymphatic drainage by microscopically lifting up the skin. The benefits of kinesiotaping helps to reduce swelling, pain, inflammation, and it can be used for both sport and mechanical injuries and post-surgery recovery. It also provides support for muscles and helps to activate them to allow lesser restriction in movement through range. All these treatments can be used on students, adults, athletes, and sports enthusiasts. That's all the time we have today. See you in the next video.
Hi everyone, good afternoon. Before I start, I just want to do a mic and a video test. So if you can see me and if you can hear me clearly, please type yes in the chat box. Everyone, if you can hear me and if you can see me clearly, please type yes in the chat box. Yes, very good, very good. So I think everyone can hear me and everyone can see me clearly. Okay, very good. And if let's say there is a lag, right? So if you realize there's a lag in the connection, you can also type in the chat box. Okay, sometimes if there is too much of a lag, you might need to sign out and sign in again. Okay, you might need to sign out and sign in again. So without further delay, I'm gonna start my slide now. Okay, so before we begin, a little bit of a background about our practice. And about myself as well. Sorry, my name is Anson. So I'll be talking about knee pain, treatment options, and some things that no one have tell you before. Okay, um, everyone will learn something about the knee today, whether it's the cause of the pain or whether how to treat it. I promise that everyone today will learn something new, all right? Something that no one has tell you before, okay? So I have been working as a physiotherapist for the last 8 years. I started in National University Hospital. And then from there, after about 6 years of practice, I came to the pain relief practice. So the pain relief practice is founded in 2007. We have been around for about 13 years now, and we have done more than 50,000 sessions in the clinic alone, right? So in the clinic, we receive patients from all over the world, from Indonesia, Malaysia, Myanmar, Cambodia, Maldives, Seychelles, UK. So basically all over the world. Other than our clinic here in Singapore, we also have a few international clinics. One in Lipo Mall, Grand Galaxy Mall, UOB Plaza, and as well as Tunjongan Plaza. Okay. So a little bit about my sharing. So I remember I did my first sharing on a Chinese newspaper. So if you see on the left-hand corner is the Zhao Bao. All right, and over there in the newspaper, I shared about exercises for osteoarthritis. Okay, so from there, after that, I did some sharing on Facebook. It was a 6 episodes, mainly about pain and also sports injury. And then after that, I went on the Love FM. It's a radio show, a radio talk show with live Facebook Live. And in the session, I shared about common pain and what are some of the simple things that you can do that is effective and easy to do. Okay. Other than that, the clinic, the pain relief practice, we are also a Singapore official partner for Singapore Table Tennis Association, right? So basically, we provide the athletes as well as the training support. If they are injured, if they have pain, we will help to rehab them. We use some of the very advanced medical machines to help them to recover. So that's a little bit of background, and yeah. So let's continue. So you might be wondering, how's our clinic different, right? From other physio clinic, or from a chiropractor clinic, or from a TCM clinic, or osteopath clinic, right? You might ask me, Anson, how is our practice different? So basically, when we see a patient, right, we look at it from a very holistic, a very complete point of view. For example, if today you come over with a knee pain, we will take a very complete approach in solving your problem. So we mainly focuses on 3 pillars. Number 1 is nutrients, right? So what is the nutrients that is right for your knee condition? What is the nutrient that is required to help your knee to recover. So that's number one. Number two, we use advanced medical technology in our clinic, mainly from France, mainly from Spain as well as Italy. We have German as well. Some of this technology that we use, and the machines will be able to help your knee to recover much faster. The machine will be able to help you to get rid of your knee pain. Now, last but not least, as a physiotherapist myself, of course, I'm very into external muscular support for your joint. So if today your knee pain, you're here in the clinic, not only will I look at the nutrients, uses some of the very advanced medical technology to help you to recover, but I'll be also checking and assessing your muscles, right? Whether it's too tight or whether they are very weak, whether there's any misalignment. And through therapeutic exercises, we are able to help you to recover much faster and also prevent the pain from keep coming back in the near future. So before I move on further, I just want to make sure that everyone that's listening right now understand that this is the right talk. This is the right webinar for you, right? So if you have knee pain with activities, right, you feel stiff on the knee, and when you get up, you have to wait for a while to warm the knee up before you can walk normally. Some of you may also have before the MRT stops, you need to stand up first. Before the bus stop, you need to stand up first because your knee is slow to warm up. Now, if you have this, today you're at the right webinar. If you have weak knees, right? Now, what I mean by weak knees is if you walk like 5 minutes, 10 minutes, you feel very heavy on the leg, then this is the correct webinar for you. Now, if you're tired of looking around for solutions, you have tried so many things and you're not recovering yet, you're not 100% recovered, this is also the right webinar for you. If you want to be guided by a professional medical personnel, if you want to have a very effective solution which has scientific basis, a solution that is proven, then you are at the right webinar. Of course, now if today your pain is because of cancer, right? You have cancer-related knee pain, then I won't be able to help you through this webinar. If you have fracture of your knee and you're recovering from the fracture, this will not be a very suitable webinar for me to help you. Okay? Otherwise, I promise every one of you here right now, I promise every one of you that's listening, you will learn something new today. You will learn valuable knowledge on knee pain today. All right? Things that you have not heard anyone else talk about, things that you will not hear from your doctor or your other therapists. Okay? So before I begin, I just want to run a poll. Before I begin, I want to run a poll. I just want to ask every one of you here if you have knee pain or if you have any problems on the knee. If you have, please click yes, I have. If you don't have any knee problem, no pain, please click no. If you are just listening, you are listening for your parents, if you're listening for someone else, that has knee pain, then you can also just click no, you are no knee pain, you're all good. Okay, I can see a lot of people is answering right now. Just a few of you have not answered yet. We'll give another about 10 seconds, okay? Okay. Very good, very good. Very fast response from all of you. Very fast response. So I'm just going to end the poll now and let's look at the results. So very interesting. Most of you have some problems on the knee, be it pain, it could be stiffness, anything that's not right with the knee. Only a small amount, so maybe about 20% of you has no problem on the knee. So very good, very good. Everyone is going to benefit from this webinar today. So before I talk about the knee itself, all right, we'll be talking about this triangle, right? This is a very important health concept that I want everyone to pay attention. Okay, so I want everyone to stop whatever you're doing right now and listen very carefully because this concept is very important. Okay, so what is it that you are seeing now on the screen, right? It's a 3-point health triangle. All right, now the 3-point health triangle consists of 3 main components: inflammation, internal, and external. Okay, now I'm going to use knee pain as an example. So if today you come to my clinic, you come to see me and you have knee pain, I will ask myself 3 questions, right? Number 1, is there inflammation happening inside the knee joint? Okay. Number 2, any derangement, any injury, any damage internally in the joint itself. Number 3, what's going on outside the joint? All right. For example, it may be some muscles are very weak, so cannot protect, cannot support your joint. Maybe you have flat foot, right? You have flat foot. That's why there's uneven pressure on the knee, causing it pain on the inner side of the knee, right? So very important. If today you are seeing any doctor, if you are seeing any therapist, please try to ask them if you have any of this, right? Inflammation, internal as well as external. All right. This is very important because only by identifying, only by answering these 3 questions, you can effectively and you can manage your knee 100%, right? Otherwise, your knee will not recover 100%. You always have this problem of a residual issue in the knee joint, right? So very important, 3-point health triangle. And we'll be using this concept later in the talk as well. So first thing that I want to teach everyone today is, what does your knee look like? And what is your knee joint? Okay. Now, when you talk to a medical professional about your knee, right? To us, what we hear is not just one, okay? Your knee joint is not just one joint. Your knee joint actually consists of 3 different joints, okay? Now, I'm sure most of you don't know about this. Your knee actually is not one joint, it's 3 joints, okay? And it's very important to find out where is the problem coming from. It can be from all 3 joints, or it can be only one joint, right? So if you do treatment on the wrong part, all right, if you do treatment on the wrong part, you do treatment on the wrong joint, then of course you will not be able to recover effectively. So the first joint is the space behind the kneecap. So if you look at the picture, the circle is where the first joint is. It's called the patellofemoral joint, right? That's your first joint. Next, you have the second and the third joint. It's called the medial and lateral joint, right? The medial tibial femoral joint and the lateral tibial femoral joint. Okay, so these are, if you look at the picture, is the circle area, and it's on the inner side and outer side of your knee joint. Okay, so all in all, your knee has 3 different joints. Okay, and for example, when you're doing exercise, if you have pain on the first joint and you have pain on the second and third joint, you actually need to do different exercises. Okay, so for example, let's say if you have pain on the first joint, right, which is the space behind the kneecap, if you have pain on the patellofemoral joint, right, the space behind the kneecap, if you do a leg extension exercise, so it's the one where you sit and you kick up, right, it will actually causes more pain to your problem, right? So if today you are doing exercises and you realize that some exercise after doing is more painful, now the reason is because you're not sure which joint is having pain, right? Whether it's the first, second, or third joint, and the exercise that you did actually will make one worse, make the other better. Okay, so it's very important. If let's say again today you are seeing a doctor, if today you are seeing a therapist, you need to check with them which joint is painful. Is it the joint behind the kneecap, or is it the one where the femur bone and the tibial bone connects, right? All right, this way. Okay, is it the one at the front, or is it the one at these 2? Okay, right. So of course, your knee joint also consists of muscles, ligament, tendon, meniscus, cartilage, and fascia. Okay, so every single one of these can also causes pain to you. Right, every single one of these, if injured, will cause you to suffer from knee pain. So now we move on to the most important question. Why do you have knee pain? What is wrong with the joint? Why do you have pain, right? So if you look at a medical textbook today, if you open up a medical textbook, there are so many causes for knee pain that it might take me 24 hours just to finish all of them. Okay, but don't worry. I'll be talking about the 3 most common ones, right? The 3 most common ones, And it's so common that basically every one of you would likely suffer knee pain from one of these 3 causes only. Okay, only one of these 3 causes. So very common. The first one is, of course, you sprain the knee. The second one, osteoarthritis, and last one, meniscus injury. So these 3 is very common. Almost every day, patients that come to my clinic, they come and see me, have either one of these, right? So let's talk about the first one, knee sprain. Okay, so what do I mean by knee sprain? So knee sprain is when you accidentally miss a step on the staircase. Knee sprain is when you accidentally twisted your knee while walking, right? Knee sprain can happen when you try to rush traffic light, you try to walk very, very fast, you miss a curb. All of this, right, can sprain your knee. Okay, so basically for knee sprain, the injury can be severe or the injury can be very mild. So you may have someone, or you may have heard of someone who has knee pain, went to see a doctor, went to see do any treatment, and just one session the pain has disappeared, right? And this is very likely that the person is just suffering from a knee sprain, right? A very mild knee sprain. That's why it can recover very, very fast. Okay, that's a knee sprain. Knee sprain can happen to anyone or at any age. You can be young, you can be a teenager, you can be middle-aged, you can be old. It is all doesn't matter how old you are, it's possible to sprain your knee, right? Basically, when you sprain your knee, the treatment is simple and optimistic, right? In the sense that when you sprain your knee, it's very high chance that you will recover very well. Very high chance that you will recover very well. And later in the slides, right, and then towards the end of the slides, I will share with you what are some of the things that you can do to help you to recover from knee sprain. So next we move on to the second cause. Now the second cause, very common, is a meniscus injury. Okay, so there's 2 types of meniscus injury or meniscus damage, whatever you like to call it. Okay, now the one that we always see is, of course, when you play sports injury, right? Your friend tackled your knee. If you're playing golf, you accidentally twisted the knee, and all of this may damage the meniscus. Okay. Now the second type is something that's more gradual and accumulated, right? It's called a degenerative meniscus disease, right? So basically, as we get old, as we age, our meniscus become more fragile, right? So it's very easily it will break, very easily it will tear. Okay, so there's 2 types, right? Number one is from injury, sports injury. The second one is degeneration, right? So the degeneration meniscus issue is quite common because as everyone age, there will be some problem on the meniscus. Okay, so how do we know? How do we know if you have meniscus injury? Okay, so the gold standard is to take an MRI, right? You take an MRI, see inside the knee, and you can tell, if there's a tear on the meniscus, right? Whether it's partially torn or whether it's fully torn. Okay, so you can do an MRI. And today, MRI costs about, on average, 1,000 or above, depending on where you do it. So if you ask me, Anson, MRI is very costly, I don't want to do MRI. How else can I know if my knee pain is likely from the meniscus? So again, pay attention, right? There's 3 things that you can look out for. There's 3 things that you can look out for. And if you answer yes to all these 3, then very high chance, when you go to the doctor will say, it's the meniscus problem, right? If you answer yes to only 1, then, it's hard to tell, okay? So the first one, locking. Now, what do I mean by locking? It means that when you are walking, when you're moving your knee, sometimes, for no reason, you suddenly feel that the knee is stuck at a certain angle, right? So you move, then it gets stuck. And it might take a very short while to just continue to move again. So it happens only at that moment. Or it may take a few minutes, right, to spontaneously, for it to resolve, okay? And some people, they have to massage the knee. Some people, they have to, sleep. And then the next day wake up, only it gets better, okay? So that's number 1, locking, right? Locking. Now the second is your range of motion of the knee, right? The movement of the knee will be affected. Okay. Now, what do I mean by that? If let's say you can't fully straighten your knee, or if you can't fully bend your knee, then it could be the meniscus, all right? Depending on the location. If the meniscus is torn at the front, it may cause your knee to get stuck and can't fully extend. If the meniscus torn at the back, then you might get knee pain when you squat down, and you get knee pain when you try to bend your knee fully. Okay, so that's the second thing, right? The first one is locking. Now the second one is the range of motion of your knee, range of motion. Okay, and the last one, the third one, if today you have meniscus problem, your pain will likely only come when you are putting pressure on your knee, right? That means you likely feel pain when you're standing, when you're walking, when you're, with the legs on the ground, all right? Now, why is that? This is because meniscus is a shock absorbing structure in your knee joint, right? So your meniscus is supposed to absorb the shock that passed through the joint, absorb the shock so that it doesn't directly goes into impact on your cartilage, on the bone, all right? So they are shock absorber. And if today there is injury, if it's torn or it's worn out, then, it won't be able to function properly, and you'll start having knee pain from all those impact and stress to the knee joint. So that's meniscus injury. Okay. Now the next one, very, very common. Almost everyone have heard of this, osteoarthritis. It's like the champion of knee pain, osteoarthritis. So basically, what is osteoarthritis? Osteoarthritis is when the doctor tells you that, your knee is bone rubbing bone. Osteoarthritis is when the doctor tells you that, your knee no more gel already. Your knee got spur inside. Okay, you need to go for surgery. All right, that is osteoarthritis. Basically, what it means is that in osteoarthritis is wear and tear of the knee joint. Okay, it's a wear and tear, it's a degeneration, it's an aging problem. Okay, and because of this, it's a progressive disease. Now, what do I mean by progressive? That means, right, you can't really cure it, right? You can't cure it. You can't make your knee 18 years old again. Okay, and as you grow old, as you age, the joint becomes more fragile, more soft, and then it becomes worn out even more and more and more. Right? So if today you take an x-ray of your knee, if osteoarthritis, 10 years later, 20 years later, you take another x-ray, and it's very, very likely you will just realize that 20 years later, the x-ray is going to be worse than today, right? It's understandable because it's progressive, okay? So there's not really a cure for it. Some people, they do operation, right? Change to metal knee. Then, of course, if you have metal knee, then there's no osteoarthritis because it's metal. Right, but that's like cheating, correct? So, yeah, basically don't really have a cure per se. But does that mean that if there's no cure and if it's progressive, will it mean that eventually your knee will become worse and worse and worse? Then you'll start limping, then you end up in a wheelchair. Okay. So this is a difficult question to answer because it can be yes and it can be no, right? Okay, why do I say that? Yes, eventually it will become worse and worse if you don't do anything about your pain right now. Okay, if you're suffering from pain and you're just letting it be, don't care, maybe take some painkiller and that's it, maybe put some hot pack and that's it. Of course, then over time, your knee will become slowly more and more and more injured, right? More and more worse, right? But today, if you have very, very bad knee pain, very bad if you are already limping, and you decide to treat the knee, right? For example, you come to the clinic, come and find Anson, come and find me, and you do manage the knee, you treat the knee, then of course you won't eventually become wheelchair bound. You won't eventually, cannot walk at all, right? Because you are treating it, right? And it will get better, right? Better meaning, less pain, more strength, you can climb stairs, you can walk longer. That's what I mean, okay? And how do you do that? Don't worry, later in the webinar, the second part of the webinar, I will tell you about it, okay? So if you look at the picture, very common, we'll see two types of knee, right? One is I call it knot knee. So, your knee is touching the knee, is shaped like a V, The next one is a bow leg, right? Bow-legged, your knee will shape like an O. Okay. So for these two problems, a lot of times, it runs in the family, meaning, your parents may have it, your uncles may have it, your auntie may have it as well. Same thing as what you have, right? So yeah, it does happens in that way. Okay. So that's basically osteoarthritis. Now, same question. How do you know if you have osteoarthritis, right? So the gold standard is you see a doctor, take an x-ray, right? Then they can see, oh yeah, the joint no more space. Got bone spur inside. It's worn out. But if today you don't want to take an x-ray, how can you still tell if you have osteoarthritis? And the answer is yes, you can. If you look at the screen in 2015, there's an article being published by National Institute for Health and Care Excellence. Okay, so the National Institute for Health and Care Excellence is basically a public government body in the United Kingdom, UK, right? And what they do, right, is they publish guideline. They guide the medical professional in the best practices for conditions. Okay, so basically they are like the teacher lah, so called. And in 2015, they published this standard for osteoarthritis. And in it, right, it teaches you or it tells you how do you determine if someone has osteoarthritis. Okay, so everyone pay attention, right? Drop whatever you're doing, pay attention. You only need to answer 3 questions. Okay, so through these 3 questions, you can tell whether if you have high chance of knee osteoarthritis or there's a low chance of you having knee osteoarthritis. Okay, so get ready. You might, if you want a pen and paper, you can do that, write it down. If not, just listen to me. The first question: are you 45 years old and above? Right, and that's the first question. Are you 45 years old and above? Now the second question: do you have knee pain with activities? Okay, do you have any activity related joint pain, right? Knee pain. And the third one: do you have any morning stiffness in the joint that is shorter than 30 minutes? Okay, morning stiffness in the joint that's shorter than 30 minutes. And that's all the 3 questions you need to ask yourself. Okay, that's all 3 questions you have to ask yourself. Okay, are you 45 years old and above? Do you have knee pain with activities? And do you have morning stiffness in the joint, right? And the stiffness is shorter than 30 minutes. Okay, and this is very important. Why shorter than 30 minutes? Because if it's longer than 30 minutes, it could be other systemic disease. For example, rheumatoid arthritis, right? So through these 3 questions, then you can tell. Okay, so now I want to run a poll, right? I want to run a poll. I just want every one of you to ask yourself these 3 questions. Okay, you ask yourself these 3 questions, and then you answer. Do you have osteoarthritis or not? Do you have osteoarthritis or not? Okay, if you answer all 3 yes, then very high chance you have osteoarthritis. If you only answer 1 to all 3, then low chance, then you can just click no. Okay. If you answer 2 out of 3, you're not sure, right? If it's 2 out of 3, you can also answer yes. Okay. And if you want, what you can do is you can type in the chat box. Type in the chat box, which question you answer yes, which question you answer no. Maybe later I can just have a look at it and guide you through what are the likely problems, right? And if you already been diagnosed with osteoarthritis, then you can double confirm, right? You ask yourself these 3 questions. Very high chance you'll answer yes to at least 2 questions. And I'm sure most of you who has osteoarthritis will answer yes to all 3 questions. Okay? So I'm going to give another 10 seconds, just 10 seconds for everyone to answer, okay? I think most of you have answered already. So another 10 seconds, yeah? So very good. I'm going to end the poll right now, and I'm going to share the result. So very interesting. 3/4 of you, so most of you has osteoarthritis. Small portion of you, so about 1/4 of you don't have osteoarthritis. Okay. I have seen some, question and chat in the chat box. Don't worry, later I'll come to it and I'll answer, the question for you. Okay. So next, we look at this another statement, right, by the National Institute for Care and Excellence. So if you look at the slide, a very common question or very common thing that I hear from my clients, they'll ask, hey, Anson, the doctor say, my knee is bone rubbing bone already. There's no more gel. We must do surgery. If not, cannot get better. Is it true? Is there any options, right? Now, if you look at this statement, it says here, if let's say if you have osteoarthritis, all right, you should, and I repeat, you should do non-surgical core treatment. Non-surgical core treatment for at least 3 months. 3 months before you think about surgery. Okay, so let's digest this statement for a short while. If today you have osteoarthritis, you do x-ray and it shows that, your bone is touching bone, there's no more space in the joint, there's a lot of, bone spur in the joint. It doesn't mean, right, you must go for surgery in order to get better. Okay? Sometimes if it's very severe, you try everything, still can't work, then you have to go for surgery, no choice, then yes, that can happen. But if you look at this statement, it says here, even if you have very bad one, you should try at least 3 months. 3 months of non-surgical approach, right? Now, what non-surgical approach, we'll talk about it later in the slides, okay? But you need to try for at least 3 months before you think about doing it, okay? Before you think about doing it, okay? And that's very important because I think a lot of my patients, they see doctor, then immediately they decide to go for surgery like that, right? They're very fast without, exploring other things. So, I don't think it should be that way, because it's been already stated here. You should try, okay? You should try. Now, why sometimes, people want to avoid surgery? It's because, surgery is not exactly a very fun and nice thing to do. And there is risk that accompanied it, okay? So, there's no guarantee that after surgery, your pain will go away completely. There's no guarantee to that. And, after surgery, you have to, use the walker for a short while. It will be inconvenient when you move. The scar is not exactly beautiful. And you can have some very severe side effect, right? Some severe side effect, like organ failure and things like that, because there is infection, right? You are in the hospital, so there are more bacteria anyway, okay? So don't rush into it. Try 3 months of, conservative approach before you think about surgery, right? And we'll talk about what you can do later, okay? Now, I want to share with you some of the things that my clients do. Usually, before they come and find me, they would have tried a few things, right? You may have tried a few things as well. Very common one, they go to the gym, sign up a fitness package, and then, try to work out, make their legs stronger. They cycle, treadmill. That's one. Some people, they are being told that, their spine is not aligned. So, must do some adjustment to correct it. Being in an Asian country, we can't escape, acupuncture, Chinese tuina, we can't escape cupping, right? I'm sure you have seen, or even some of you will have tried, okay? And last one, this is something a bit more less known. Some of my clients went to this center where they measure your foot, see how you put pressure, and then they make some modification. They customize the shoe for you so that when you stand, when you walk, it spreads out the pressure evenly in your knee joint. Okay. Now, sometimes you can get better by just doing this. Sometimes, you do it, you feel better, but, it's not 100% cure, right? It's not 100% gone, right? So if you remember the 3-point health triangle, there's a 3 aspect, okay? And most of the treatment that you see on the screen right now only target 1 or 2 aspects,
Okay, so if today you have problem, where all three aspects involved, and you do all this, it will only solve your problem partially, right? You need to treat all three aspects of it. And how do you do that? Later, I will share with you in the slides. Okay, I will share with you in the slides. Okay, now, every day there are new breakthrough in medical knowledge, in treatment, for example, right? Every day researchers are coming up with something new. They are learning something new. They're experimenting on how to improve on medical health care. So if today you have pain, since 10 years ago, you see a doctor 10 years ago, and the doctor, nothing much can be done. Doesn't mean that right now there's nothing can be done, right? 10 years, there are so many new techniques, new solutions that is out there right now that you won't have 10 years ago, 5 years ago. Okay, so I want to share with you what some of the things that has been proven, what some of the things that is effectively helpful to get rid of your knee pain. Okay, the first one we're going to talk about is nutrients, right? Nutrients. So I just want to ask all of you, I just want to run a poll. When we say nutrients for joint, okay, how many of you think that it is actually glucosamine? If you think it's glucosamine, just click glucosamine. If you think it's not glucosamine, it's something else, it's more than just glucosamine, click not glucosamine. Okay, so I'm just going to give about, a lot of you responding very fast, very good. A lot of answers I see already. I'll just give another 20 seconds for everyone to be able to, answer the question, and then we'll continue from there, all right? So everyone try to answer this question, yeah? Wow, very good, very interesting result. Very interesting result. Okay, I'm gonna end the poll. So, half of you thinks that it's glucosamine, and half of you think that it's not glucosamine. Okay, so very interesting. This is the first time I get half, right? Half. Okay, so what is the correct answer? What is the correct answer? Let's look at it. So when I talk about nutrients for your joint, I'm not talking about glucosamine. Okay, I'm not talking about glucosamine. It's already in newspaper channels, New Asia, Straits Time. It's in international journal that glucosamine doesn't really work. All right, a lot of people has actually stopped prescribing, and it's not recommended to suggest glucosamine for knee and hip osteoarthritis. Okay. So some of you may ask, hey, how come they are still selling it, right? How come, a lot of people are still taking it? Most of the time, nowadays, the product has actually other things in it, right? Now, what other things am I talking about? Sometimes they have collagen in it. Sometimes there are other herbs in it, all right? So when I talk about nutrients for your joint, I'm actually talking about type 2 collagen. Okay, I'm not talking about type 1, not type 3, yeah? Type 2 is specifically for the joint, type 2 collagen. I'm talking about herbs like ginger, herbs like turmeric, winter cherry, herbs like curcumin, or frankincense, things like that. And these are actually useful nutrients for your joint to help your joint to recover, okay? To help your joint to recover, okay? So if today you have been taking glucosamine, maybe you can consider stopping it or switching it, all right? Switching it. And I will let you know later what we have for you. Okay, now let's look at this study, right? Let's look at what studies is available for nutrients, for supplements, for joint problem, okay? So this is an article that I'm showing you right now. It's being published in the British Journal of Sports Medicine, yeah? BJSM, all right? British Journal of Sports Medicine, okay? So in this study, right, what the researchers do is that they did a systematic review and meta-analysis. So they collect a lot of studies from all over the world. They analyze the data, right? So in this case, right, they took 20 different types of supplements from a total of close to 70 studies, and they found that there are seven ingredients or nutrients that is can be helpful for knee joint, okay? And the first one is, of course, collagen, right? Type 2 collagen. But there's also like things like curcuma, frankincense, curcumin, and things like that. Okay, but if you look at the screen where it's circle, right? What the researchers found out was that it actually can help with reduction in pain. So after taking these dietary supplements for osteoarthritis, you may actually feel better. You may actually feel better. High chance, right? High chance you feel better. Okay. Next, we look at the next one. Okay. Now this is the paper in Washington Post. Right? This is the article in Washington Post, and it says that collagen, right, has shown to help joint pain not only in normal people but in athletes as well. Okay, so people who suffer from osteoarthritis and joint pain with athletes using collagen. Okay, and something very interesting I saw is that the greater pain you have, right, the more relief you get from it. Yeah, this is interesting, right? The more pain you have, the more relief that you're going to get out of taking collagen. Okay, so that's the collagen, right? Okay, don't worry, later I'll share with you what we have, all right? What we have. Yeah, I think someone is asking in the private chat, to recommend, what kind of collagen or things like that. Okay, so don't worry, I'll share later part. So the next thing that I want everyone to talk about is electromagnetic field. Okay, now this is something that I'm sure a lot of you are not aware or may not have heard about it. Okay, so what is electromagnetic field, right? Basically, electromagnetic field is a result of electrical current movement. Okay, it is everywhere and it is invincible to our human eyes. All right, so our Earth has electromagnetic field, right? When there's thunderstorm, the electromagnetic field will be strong. Because of this field, right, the compass needle can always point to the north. Because of this, birds and fishes that can navigate, right? Otherwise, they don't have compass. Okay, so what has the researcher found out about electromagnetic field? So over the course of 10, 20 years, there's new discovery, new evidence, right, being shown that pulse electromagnetic field therapy can actually help with osteoarthritis of the knee, can help with knee pain. Okay, so if you look at this Journal of Rehabilitation Medicine, okay, now this paper is published in 2009. All right, 2009 is about 11 years ago. Okay, so what the researchers do, right, is that they study the effect of this on people with knee osteoarthritis. Okay, and again, right, it's a meta-analysis. So they collect a lot of studies. They collect, they analyze the data, and then they come up with a conclusion. Okay, and in this paper, the researchers realized that with pulse electromagnetic field therapy, it actually improves clinical scores and function in people with osteoarthritis of the knee. Right, now what do I mean by that? Clinical scores and function. It means less painful, can walk longer distance, can climb stairs with less pain, can climb stairs much better, can stand longer. So a lot of things like that, right, can be improved with the application of pulse electromagnetic field therapy. Okay, and the author in the last sentence, right, in the conclusion, right, actually recommend that you should consider this as part of your osteoarthritis management or knee pain management. Okay, so meaning if today you are doing something, you are doing exercise, you are doing acupuncture, if you are doing you're taking supplements for your knee pain, on top of doing already what you are doing, you should try pulse electromagnetic field therapy as well. Okay, should try. It will help you to recover faster. It will help you to recover better as well. So that was in 2009. So 1 year later, because I think they were trying to figure out, okay, why does it help? Why does it help, right? So 1 year later, there's the paper being published, and it's being published in International Orthopedics Journal, right? So what the author found out is that when you do pulse electromagnetic field therapy, they can actually see some form of healing in full thickness articular cartilage defect. So again, let's digest this sentence a little bit. What it says here is not only mild problem or very mild one, even if you have full thickness articular cartilage defect, that means the joint, right, the cartilage, right, full thickness defect, okay, by doing pulse electromagnetic field therapy, it can actually help in the healing, right? Can help in the healing process, right? So no wonder all these people with knee pain, they did it and then they feel better, right? Because it can help with healing, all right? And so this paper is published 1 year later, and after that, something more recent in 2013. In 2013, another paper is being published, right? And this time, the researchers they test right pulse electromagnetic field therapy in elderly with joint pain, in elderly with osteoarthritis, okay, and let's see what they find, right? So what they found is that with the pulse electromagnetic field therapy, it actually improves pain, stiffness, and function in elderly people that has osteoarthritis, okay? So I think some of you may have stiffness in the joint and you are not sure what to do about it, right? For example, when you wake up in the morning, you feel stiff. When you sit for a long time, you stand up, you feel stiff. Or when you don't move, basically if you don't move for a short while or a long time, then when you want to move, it feels a bit stiff. So actually pulse electromagnetic field therapy can help in that as well. Okay, so very useful way of treating. Okay, so now all these are being done internationally, all right, overseas, right? But even locally, there is research being done on this aspect as well. And very recently, it was being published. I think it was being published 2019. So last year, beginning of last year, right? And the research is being done by NUS, and they did this research in NUH. And I still remember because back then I was still there when they are conducting these clinical trials, right? And so what they do is they take a group of patients who after go for surgery, they split them into 2 groups. Okay, so one group will just do physiotherapy in the physiotherapy department, right? So they come here, find answer, do physio, blah, blah, go home. The second group is on top of seeing a physio in the department. They get the patients to come back several times a week, put their leg into this machine that you see in the picture, this round hole thing, and then they run the electromagnetic field, all right? And basically what they found is that those that did electromagnetic therapy, right, the muscles recover faster. They have a better recovery, right? They have a better recovery, okay, in the knee joint itself, okay? So I think there's a question here was highlighted to pay attention, asked by Valerie about how is it done. What do you mean by how is it done? Like, you mean the electromagnetic field therapy, or I think possibly it's electromagnetic field therapy, right? So basically, don't worry. Later, at the end of the day, I'll share with you what we can do and and how you can do it. Okay. So the next one is a support brace. Okay. Now, if you remember, but what I talk about bow leg and also like a V-shaped knee, knock knees, right? Some people is when it's quite bad, they go for surgery to adjust it, right? When they do knee replacement, the doctor help them to adjust the angle a little bit so that their knee become a bit more straight, right? But if today, it's just the beginning, and you want to like slow it down and you want to manage it, you don't want to be like become more and more bent so fast, right? Something that you can done is a support brace, okay? Now, I'm not talking about the kind of brace where you just buy from Guardian or Watson, right? I'm talking about a brace that is designed specifically for arthritis. It's the hard brace, right, that will help to apply a pressure at 3 points of the joint to make the alignment better, okay? To make the alignment better. So if you look at the pictures here, right, you can see that on the left-hand side, there's the circle there, it's less what do you call it? Less space in that joint. Now, after a treatment with the knee support, right, They take another x-ray. Then they realize, hey, there's a better joint space. There's a better joint space in the area. So it actually shows you that, wearing the brace can help, and it will help to make some adjustment in the alignment as well. Okay. And more importantly, if you wear it, you don't have to wear it 24 hours. Most of the time you wear it when you're walking outside, when you're out from your house, right? When you're going for work, you just wear it. And then, it shows that it helps to slow down the bending of the knee. Okay, it helps to slow down. Now I had two recent one. I have two of my clients that purchased this brace. One of them is they maintain the school, right, like primary school. So basically, he has to walk a lot. He has to climb stairs, he has to squat down, and he also have this very bad bow leg. Right, it was so bad that when he walked, right, he's limping sideways. Okay, and we let him try onto the brace, and after trying it, he feel, with the brace on, he can walk better, he can climb stairs, and he can squat down without feeling much pain. So he decided to buy it. He buy both sides. Okay. So then today he's telling me that he can walk very good, he can walk, he can climb stairs, no issue, no pain, very, very good. It has helped him to be able to do his work in the school tremendously, right? And the other one, he's a supervisor in like a building lah. So every day he has to go up and down, climb stairs because the lift very slow, right? So same thing. Now in this case, his bow leg or his not only the shape, right? It's not too bad. It's not too bad. So he bought it as well, and he can just zoom up and down the staircase very nicely, no pain. So very good as well, actually. Okay. So if today you have tried different things, it doesn't work, your knee alignment is not very good, something that you can think about is this support brace. Okay. Now the last part, of course, the last part is a physio. We talk about improving the muscle support for your joint, right? So very important. You need to do exercises to strengthen up the muscles around the knee. If not, they can't protect your knee joint. They can't protect your knee joint, and some people they ask me why, how come they do some treatment already, some other treatment, and then the knee become better. Then a few months later the pain come back. Few months later the pain come back. 1 year later the pain come back. But if you don't have a strong muscle to protect your knee joint, of course, the pain will keep coming back. The pain will keep coming back if your muscles cannot protect your joint, right? So then I want to ask a question. How many of you is doing exercise and is sure that you're doing the right exercise? Okay. So I want to ask a poll. Okay, let's start. So I want to check. Are you sure if you are doing the right exercise? If you are sure, click yes on the screen. If you are not sure, click no, I don't think so. Okay, let's see how many people. Oh, wow, okay, very fast. Well, I can see the answer jumping. Yes, no, yes, no, yes, no. Very good. I'll give another 20 seconds for everyone to try to answer, okay? Okay, very interesting result. Okay, so most of you are not sure if you are doing the right exercise. Okay, most of you are not sure. 33% of you is sure that yes, absolutely, I'm doing the right exercise. So that's very good. If you're doing the right exercise and you're sure you are better, continue with the exercise. Now it's good to even do it when you no longer have pain as well, because you want to maintain them, right? You want to maintain them. Okay, and for those of you who are not sure if you're doing the right exercise, it's very important. It's very important to do the right exercise, because if you do the wrong exercise, sometimes it will slow down your recovery, right? It will limit your recovery. It will make your recovery very challenging. Okay, and you need to do the right exercise, so that when you get rid of your pain, right, it will never come back. Okay, for as long as possible. So now let's talk about the evidence, right? The evidence and what the researcher says about exercise for knee pain. Okay, so this is an article that is being published in 2015. It's also being published in the British Journal of Sports Medicine. Okay, British Journal of Sports Medicine. And I want to bring your attention to what the conclusion is, right? What the researchers says about the conclusion. Okay. Now the researchers find that if, let's say today you have knee pain, knee osteoarthritis, right? Doing land-based exercise. Now land-based mean your legs on the floor, not swimming, not in the pool. Okay. Land-based exercise will provide you with benefit, right, that will last at least 2 to 6 months after you stop exercising. Now let's digest this sentence for a little bit. What the researchers is telling you is that by exercising, you get a benefit that, let's say if today you stop your treatment, you come, let's say for today, you come to the clinic, you see me, exercise, right? Okay, done. Today, last day, finish. Then when you go home, you are lazy to exercise, you don't want to exercise. You will still get the benefit, even next Chinese New Year. That's what the researcher is trying to tell you, right? You do this, you do exercise today, you get the benefit for the next 2 to 6 months, even after you stop. And that's something that's very powerful. That's something that's very, very powerful, right? So if you're not exercising yet, this is the right time to start now, right? This is the right time to start. And then we look at another paper, and this is being published more recently, right? This is published more recently. It's 2019. Okay, so in 2019, the researchers did a study, right, to see if exercise can prevent knee osteoarthritis. Okay, so some of my patients, they'll ask me, oh, Anson, I've my knee are no more gel. If I exercise, will it become worse or not? Like rubbing each other. So, if you look at the conclusion, the researcher says that not only exercise can prevent the onset of osteoarthritis, it can also postpone the need for joint replacement. So if today you're let's say 30 plus years old, 40 years old, you start hearing sound on the knee, you're a bit worried, right? Maybe next time got very bad knee pain. What you can do is you can start doing exercise, right? Exercise. Now, what exercise you need to do, right? Later, I'll tell you what you can do, right? You need to start doing exercise because it can prevent the onset of osteoarthritis. And if today you already have osteoarthritis, doing the right exercise can actually postpone the need for you to do surgery. Okay, so it's very, very powerful. Exercise is very, very powerful. Okay, so these are the 2 articles that I just want to share with you on exercises. Okay, so now we'll come back to the health triangle that I mentioned in the beginning, the 3-point health triangle. Okay, so if you look at these 3 components, the 3 solutions that I mentioned just now: nutrition, pulse electromagnetic field therapy, and exercise. Now, all these 3, right, can actually target all these 3 components in the 3-point health triangle. Okay, the nutrients, the dietary support, the electromagnetic pulse electromagnetic field therapy can help with inflammation and internal joint damage. Now, the exercise can help with the muscles that are supposed to protect the knee. Okay, so very, very powerful 3 solutions that I have for you all today. Okay, so next, let's look at where you can get this. All right. So if you Google online, for pulse electromagnetic field device, you can see a few. They are not very, very cheap actually. Some can be more than $10,000. It's a bit bulky. Some is like a mat, right? And it's just one mat will cost you about $600 plus $900 plus $. So it's these are the price range that you're looking at. Next. Some of you maybe, Anson said, exercise is good. I want to go exercise, but I don't know how to exercise. I want to, get a personal trainer to train with me. No. So I roughly check personal training, per session is about $90, $95. Okay. And usually you can't just sign one, right? You have to sign a package, right? So the package can be easily from, 1,000 to 1,008. And if you do it once a week, that is less than once a week is about what, 3 months, or maybe less than that. Okay, depending on how often you go, right? Depending on how often you go. So personal training is one way, but it's a bit costly also. The next, right? Some people, they go for Cairo, right? They go for Cairo, and I was looking at the pricing. They usually do packages, and it can be $2,000 of package, can be $4,000 worth of package, for many sessions, right? And sometimes you have to go 3 times a week for 3 months, for 6 months. So it's a bit costly too. And if you want to talk about the shoe that I mentioned just now, I think it's Apple's therapy, right? It's about 2,000 plus, and this is I get from their UK website, so about 2,000 plus pound. In Singapore, I'm not sure how much is the price, so that's another options that you can find. Of course, if you go for surgery, it will be very expensive, right? 30 over 1,000, 40 over 1,000. If you do it in the public hospital, 10 over 1,000. So these are like the pricing that you can get online, I think. Right? These are the pricing, okay? So things are a bit costly, but I just want to offer you guys today, right? I can only invite 10 of you to join this complete knee recovery program, right? So in this program, right, we will try and treat your knee. We will treat your knee by targeting all 3 components, right? So inflammation, internal joint derangement, joint damage, and external muscle problem. So this program is a 3-month program where you get 3 months of dietary supplements, and we will include one advanced electromagnetic, right, pulse electromagnetic field device, right, for you, 3 months, okay? On top of that, you come to the clinic one time. There'll be one session for treatment in the clinic. So when you come to the clinic, I'll look at your leg. I'll do a very full assessment, get a very detailed assessment to see what is wrong, what is really, really wrong, and answer these 3 questions, right? If there's any inflammation in the knee, any joint damage in the knee, and is the muscles okay, right? So you have one visit to the clinic, then followed by 3 online sessions, right? So the 3 months program, come one time to the clinic. The other 3 will be online video follow-up, okay? And also exercise equipment, right, for you, okay? So this 3 months very complete knee recovery program, usually we charge $1,965. But today, I just want to give something back to all of you because you guys have been listening to me, all right? So I want to give you 50% off today, 50% off. And this offer will only be eligible for today, all right? For today, 30 minutes only, okay? 30 minutes only for today, all right? Okay, $997, and I can only have 10 out of so many people today. I can only have 10 person to join. Now, why 10 is because during this, right, there'll be one-on-one guidance, and I will handhold all the participants on how to recover fully from it, right? I'll handhold all of you, okay? So very, very, very good deal. It's only 50% off. Okay, now some of you are asking me, right? This $997 is Singapore dollar, okay, Singapore dollar. And some of you may be asking me, hey, Anson, how do I know if this will work for me, right? I mean, how do I know it will work, right? So you're not the first person to do this, don't worry. Over the years, we have many, special clients, I would call them, special clients that have visited in the clinic. We have Zhang Yaodong, we have, Andy, we have Bonnie, we also have influencers like, Mr. Pretty. So all these people have come to our clinic, try our treatment, have helped them get better. So don't worry, right? Don't worry. You will get better. Other than that, you can also look at some of the reviews that we get, right? Some of the reviews that we get, and a lot of happy clients. If you look at it, it's young people with joint pain, middle age with joint pain, whether it's a guy or whether it's a girl, or slightly more elder, already have white hairs, they all recover from our services, recover from our knee treatment program, right? So don't worry, if today you have knee pain, you can recover from it, okay? Don't worry. Now, If you also look at some of the reviews that we have, and in the comment, I just want to highlight a few things, right? If you want, you can look at it from Google. If you want, you can also look at it from Facebook, right? If let's say your knee pain has been quite long already, it's chronic. So sometimes people, when they have chronic pain, they feel a bit no lack of confidence that it will get better. Now, even today, if it's chronic, for example, you look at the review Annie, right? Knee pain for a long time, and comes to our clinic, do our knee program, and the knee condition has improved, right? It's improved. So even if it's a long pain, long-standing pain, chronic, you can still improve. Okay. If you look at Natalie's comment, Natalie's suffered from chronic knee pain, right? Came to our clinic, joined the program, tried to do treatment. Again, after several treatments, we have successfully relieved their pain, right? So don't worry if you have pain for a long time, it can still recover. You can still recover. And some of the more conversation that I have with some of my patients, right? For example, for Mr. Freddy, you can see that the right knee feels so much better, less pain during walking. And this is just one session. This is just one session, right? Came in July, and just one session, much better, right? The other patient, Rohayu, right? So she wore the pulse electromagnetic field device on the knee at night, and she told me actually when she wakes up, it's not so painful, not so stiff anymore. Okay, so same thing, only one session. This is one session, right? One session. And some of the participants who have completed the program also very kind to give us a review, right? So for example, May, so she was saying that at first she's a bit hesitant whether or not to join the program, right? But she's glad she did, and she has recovered very good, very good, right? So Mika, so if you're hesitating like what May is, don't hesitate, because not every day you can get it at 50% off, only 997, and I only have slots for 10 people. Okay? So the other one, Madam Chan as well, he feels that value for money, right? Because she also got she managed to get 50% off. So value for money, right? I'm very happy with the program. Okay, and I'm also very grateful that she allows us to use her picture for this webinar, right? So another patient, Mr. Rudy, also completed a graduate from this program, and you can read. He mentioned here tremendous improvement, right? So I'm very happy to be able to help. So if today you're not sure if the program can help or not, don't worry. You're not the first. A lot of people have tried, a lot of people have recovered, okay? So don't worry, right? Okay. So before I start answering questions on the chat, if today you have a question, feel free to ask me in the chat box. Whether it's questions about knee, whether anything, because it's not every day you get a chance. Not every day you get a chance to ask a physiotherapist, right? For free, right? For free, okay? So before I move to the Q&A session, if I have only one takeaway from all of you today, only one takeaway is, if I can only give one advice, my advice is don't wait. Okay, why I say don't wait? If you have pain today, don't wait. You have to do something about it. Most of the time, right, our body gives early warning, right? So it will start from mild pain. For example, it comes on and off. Sometimes have, sometimes don't have, and you only feel it after excessive activities or certain sports, right? Then slowly, it becomes more and more obvious. When you start having pain with normal activities, daily activities like cooking or prayers, climb stairs, some even walking, right? Walking to MRT, walking to work. Painful, very painful. So don't wait for it to get worse. Because you see, now healthcare is very accessible and healthcare is very affordable. In the past, people, take pain as part of their life, right? It's something they thought is something that is unavoidable as they age, and we are scared to go to the hospital or clinic, In the olden days, that's how people end up doing surgery on the knee, right? They end up in wheelchair, or they have to use a walker to walk. So don't wait, because like for example, it doesn't have to be this way. My grandparents, by the time they told us about their knee pain, it's so bad that they need to use a walking stick already. And no, it doesn't have to be this way, right? It's not a very scary process. Okay, I've already shared some of the solutions that is painless, and most importantly, it's effective to you, right? I've shared some of the reviews, feedback from my clients that it's effective, whether it's chronic or whether it's acute. Okay, so your health is your wealth. Your health is your wealth. And I'm sure that every one of you that's listening right now wants to be independent, wants to be able to walk when they are old, to be able to move freely as you like, right? So if you have problem on your knees, you have problem on your knee, for today only, I just want to invite you to join us at this program, okay? I'm giving you today at 50% off. So basically it's about $2.73 a day. For $2.73 a day, I can help. I can guide you through your recovery with our program. Okay, with our program. So, if you have any inquiries about this program, you want to find out more, or maybe you're overseas, for example, you can't come to the clinic. You want to do like a full online sessions. You can just contact this number 8879-4342. Okay, 8879-4342. If you're calling from overseas, if you're texting from overseas, you need to have the +65 8879-4342. Okay, so let's answer some of these questions. Let's answer some of your questions right now. I'm going to scroll until the very end. I'm going to scroll until the very end. Okay. So some of you, has, the osteoarthritis question, right? Some of you is all 3 years. So all 3 years, very likely that if you just go to the doctor, before you knock the doctor's door, right, I can tell you likely, they will tell you it's osteoarthritis. Okay. Esther, some of you answer yes to 1 and 2. That means, right, it's painful with activities and you are more than 45 years old. So I think for your condition, if you answer yes to first question and second question, I would say it's a little bit high chance of you having osteoarthritis as well. For Krista, no observable stiffness in the morning, so very good. No observable stiffness in the morning, very good. Yes, some answer. So Norliza is saying that glucosamine has not helped much ease pain, right? Like I mentioned, right? Glucosamine doesn't work. Most of the product, it's mixed with other, herbs that was mentioned, right? Okay. And yes, you are right. Some doctors in hospitals still prescribe glucosamine and chondroitin supplements. So if today you are still taking glucosamine, I would recommend you to stop maybe you can stop. If you want, right? If you let's say you don't want to join the program, you just want the supplement, you can still contact the number and we'll make some arrangement for you, right? But to get the best outcome, you need to target all 3 components, right? Inflammation, internal joint derangement, as well as the external muscle. So it's better to join the program. It's better to join the program, right? Yeah, I was informed. Okay, already 2 people have signed up for the program, so I only have 8 slots available left. 8 slots available left. So if you want to, you better join up fast, yeah. So Esther is asking where is the clinic. The clinic is located in Shaw House Orchard. The clinic is located at Shaw House Orchard, all right? So Esther, when you sign the program, we will contact you and we'll make arrangement for you to come to the clinic, right? It's in Shaw House, okay? And Esther, actually, I want to see you in the program, right? Yes, it's $997 for a 3 months program, okay? So it's 3 months program. Come to the clinic 1 time. The rest is 3 follow-up sessions online, video online, okay? You just pay 1 time only. It's very, very value for money. Very, very value for money. So Esther, I actually want to see you in the clinic, right? I want you to join the program so that I can help you to recover, okay? Norliza, I want you to join the program so I can help you recover as well. Valerie, I hope to see you, okay? I hope to help you with recovery as well, okay? Let's see what other question. Let's see what are some of the question. Let me get the question out. Someone is saying that, oh, they actually texted us. Okay, my admin will follow up with you. Don't worry. So Catherine Go is asking, does the program works for meniscus tear? Okay, so the question is, why do we have pain, right? It's not whether or not the program works for meniscus tear. The question is, can the program helps you to remove your pain, to help you get better? Because you may have meniscus tear, but may not be the problem that's causing you pain right now, right? Right. So if you ask me if the program will help you with the knee pain, Catherine, I think likely yes, high chance, because I have patients from a different kind of problem lah. Got osteoarthritis, got knee sprain, tear a bit of this, tear a bit of that. You know, alignment not good, kneecap come to side a bit. So yes, the program is, if you have knee pain, Catherine, the program will be suitable for you. Mei Wong is asking, I have a total knee replacement on my right knee 5 years ago, and the other knee not long ago. So Mei Wong, if after the knee replacement and you still don't feel very good, still got pain, still got problem, I think this is something that you can actually try, right? This is something that you can actually try. Okay, this is something that you can actually try. Okay, someone search join as well. So now I already have 7 slots available. Okay, 7 slots available. So if you want to join, please be fast, yeah. Chandrika Shukla is asking, mine walking no problem, only climbing stairs. Only climbing stairs. Okay, so if you have problem climbing stairs, this program can help you as well. Okay, because the program will look at your knee and see, you know, what exercise is suitable. All right, what's that suitable, and some the electromagnetic field therapy. Remember that the NUS team was checking, and it helps with the muscle recovery as well. So, Chandrika, I think the program is suitable for you. I would like to help you. Okay. Esther is asking, I have foot drop on the right leg after spine implant. Now pain on right knee. So pain on right knee has foot drop as well. 70 years old. Okay, 70 years old. But an active dragon bolter, very good. Active dragon bolter. I think yes, Esther. I think I can able to help you now. I can't help you with the foot drop, but I think I can help you with the knee pain. Okay, the trick is figuring out what is causing the knee pain. Okay, what is causing the knee pain? So very good. Let's see, what is the success rate? So Valerie asking, what is the success rate? I don't actually calculate. So all the participants after the program, right, at the end, right, I will do like a feedback session. So for everyone that has completed the program, everyone except 2, everyone has mentioned that they have recovered or they have improved tremendously. You know, they are happy with the program. Only 2 has some problem, right? One is because there's a heart failure, so there's fluid accumulation in the leg. So every day the leg is getting heavier and heavier, not because of a knee problem, because of a heart problem. So that one is hard to treat. You can't really treat it unless you remove fluid from the leg. So that one not successful. The other one is she has rheumatoid arthritis, and the doctor is still struggling to control the medication. So they are increasing her medication, increasing the steroids. So that one also, I'm still following up with her even after the program has ended, because I really wanted to help her. So Valerie, if you're asking the success rate, so far I only have 2, and these 2 is because there are other problems, right? There are other problems in the joint, not related to the joint lah. So that's why they are not getting better. So yeah. So actually very high success rate, very high. Eugene is asking, can we choose the date and time for the treatment? Yes, you can choose the date and time for the treatment. If you want, it can be this week. If you want, if not, it can be next week, it can be 1 month later, no problem. No expiry date, but please don't make payment today and then come next year lah. Okay, that'll be too long already, right? Reggie is asking, how about for my mom, 80 years old? So if let's say if you're comfortable with, if your mom is comfortable and if you can accompany her, during come to the clinic as well as online video call, then I think, yeah, maybe it's possible. But if she's not comfortable with this online thing, you can contact us and arrange for clinic visit every time. Okay, we can do some arrangement for that. But maybe a bit of adjustment on the pricing, I think. So Esther Sim, very good. You will join. Very, very good. I'm not sure if you have make payment, Esther Sim. You need to click join and make payment, all right? If not, the slots will be closed lah. And if you find it a bit difficult, you can call the number, all right? Call the number that I mentioned just now, okay? So Eugene Lim is asking, do you personally attend to me if I sign up? Yes, Eugene, I'll be the one attending to you, and I'll be the one that's guiding you until this full 3 months, okay? So Maywo is asking, I have a total knee replacement on my right knee 5 years ago. Now my left knee is painful when I walk. My doctor suggests me to have a knee replacement on my left. I don't feel like having the surgery. Can I go for these treatments because I have a metal on my knee and it's risky to do electronic treatment? Okay. I'm 70 years old. My pain from my right knee is gone, but now my left knee has pain and my doctor suggests. Okay. May Wong, don't worry. The equipments here are very, very safe. We are actually proper clinic under license and care of the MOH, okay? So the treatment that we do is actually safe for your, even though if you have knee replacement on the other side, it's actually safe. So I think May Wong, I would really love for you to join this program. I want to invite you to join this program so that I can actually help you to avoid surgery on your left knee. Okay. So May Wong, I would really, really like to see you in the clinic. Okay. I would really, really like to see you in the clinic. Okay. Latest update. Now only 4 people have signed up. Only 6 slots available left. Only 6 available left. Okay. Valerie is asking, will losing weight help reduce pain? Okay. Now, this is something that no one has told you about. Yes, losing weight can help with the pain. Now, when I say lose weight, I'm not talking about losing 10 kilo, 20 kilo. So if you look at research, right, you just have, if you lose just 10% of your body weight or 5% of body weight, it actually will reduce the impact. It will reduce the pressure in your knee by a lot. Okay, it's not that you reduce 1 kilo weight, then your knee become less 1 kilo stress. No, it's the kind where you reduce 1 kilo weight, your knee, right, the stress can reduce by many times of that. So yes, losing weight can help. So Esther Sim is asking, I'm a breast cancer survivor, can still help. So Esther, I mean, your knee pain, unless your knee pain is because of cancer your cancer spreads to your knee, touch wood, hopefully it's not. Otherwise, I don't think it's linked to your breast cancer. So yes, it will be able to help. I don't think it's linked to your, unless the doctor says it's linked. Otherwise, maybe your knee pain is a separate issue. Okay. So May Wong is asking, my doctor told me that knee replacement can heal my pain only. Can I meet you at clinic because I'm not sure about the program because my right knee have done knee replacement. So May Wong, if you want to come, if you don't want to join the program, you just want to come to the clinic and pay like a proper 1 session. Yes, you can do that. You can contact the number that I give you just now, or my colleague will contact you and we will make arrangement for that. But I mean, really, May, I would suggest you join the program because you see the program also will have 1 session in the clinic. You get 3 months supplements. You also get 3 months pulse electronic magnetic field therapy. It's really, really very value for money Very value for money Oh. Can clarify if the price includes any supplements? Yes, the price include the supplements and the price include exercise equipment. So basically for the price, you pay that price, then you don't have to pay anything else. Everything that is required will be given to you, okay? It's just one time, all right? Everything will be given to you, okay? No extra charges, 997 net, okay? 997 net, no extra charges, okay? So Any other question? Any other question? So, Catherine, I hope I can help you to guide you, handhold you for the next 3 months with your knee pain. May Wong, I hope I can help you with your knee pain for the next 3 months. Esther, Valerie, Eugene, you know, I'm really, really keen to help you guys to get rid of knee pain, to help you feel much better, okay? Help you feel much better. Or Esther, you know, Reggie, your mom, you know, hopefully I really want to help you all. Chandrika as well, you know. Yeah, Mr. Sia, hope to see you in the clinic as well. Okay, any other question before I... So Lillian is asking, can you elaborate what is the portable equipment? So basically, it's a pulse electromagnetic field therapy device. It's something, so we source for something that, because you see a lot of time the equipment is bulky and it's expensive. So over the years, right, we have been looking and we found one where it's quite, it's portable, it's, you know, it's quite small. You can bring it anywhere. You can bring it for holiday. Some of my patients, right, when they go overseas for holiday, they bring it for holiday as well. And then, you know, yeah, and our patients like it. Our patients love it, right? And if you remember one of the slides just now, one of the patients wear the ring after a few days, less stiffness in the morning already. So yeah, it's a pulse electromagnetic field therapy device. Can I show a picture of the device? I don't have the picture for the device, so sorry, I can't show you the device. Catherine is asking, do the clinic opens on weekend? So on weekend, we work half Saturday, right? We work half a Saturday from 9:30 to 1 p.m. So usually our weekend is very packed. Our weekend is usually very packed. So Catherine, we can accommodate and see you on weekend, but you have to make appointment in advance. So my next 2 weekends is already full. I'll probably have to see you on the 3rd or 4th weekend from now, okay? But don't worry, should be good for you. Madam Tan is asking, my primary disease is RA and OA is secondary. Will this program help? Okay, so the program can help, but the condition is that your RA must be controlled, right? You cannot have flare-up of the RA, because when you have RA flare-up, it's whole body pain. I'm sure you know, right? I mean, the previous patient that I had, the RA flare-up, right? Neck pain, wrist pain, shoulder pain, knee pain, ankle pain, toes pain. So everything will be painful. So when that happens, you just have to rest and, you know, let medication control it first. Okay. So if let's say your primary disease is RA, but it's not actively giving you problem, it's well controlled, then yes, the program will help you. What is the exercise equipment given? So basically, it's a resistance band that will, because when you exercise, sometimes you need resistance, right? So yeah, we'll give you that resistance, right? So any other question? Any other question? So I think for Mr. Xia, congratulations. My admin mentioned to me that you have joined the program, Mr. Xia. So don't worry, we have received your payment and we will contact you. I think already make appointments, so very good, very good. Lillian is asking, all in how many in-clinic sessions? So for this program is 1 in-clinic sessions. 1 in-clinic sessions and then 3 online sessions. Okay, 3 online sessions for the remaining. Okay, so Lillian, if you want to come in the clinic, if you are more comfortable seeing me in the clinic, you can contact us, WhatsApp us. We can help you to make arrangement. There will be some pricing adjustment, of course, but don't worry. If I join the program later, after I consult you, the price is still $997, as I'm not sure now. How long is the program? So the program is a 3-month duration. It's a 3-month duration. 1 session in the clinic, 3 sessions online. And then it will be 3 months, right? 3 months from the day you start the first one. Okay, not you pay money now, then you start today. No. After you bought the package, when you come to the clinic, or when we have our first online session, depending on which one is your preference, usually is come to the clinic as the first session. And from that day starts, we count the 3 months, okay? And the good thing about this program is that when you join this program, you have access to me, right? So if you do anything today or you see something you're not sure, you want to ask me, you can text me directly. You then have to wait for 1 month, right? Or if you don't have to wait for until the appointment, then you ask me. You can ask me directly, okay? I will usually reply in less than 24 hours. Sometimes I'm with patient, I'm working, I can't reply. So this is the good thing about the program. Directly assess, okay? I can answer a question directly. Any emergency, you call me, I can help you with that. So May, I'm not very sure if I consult. Yeah, I'm not very sure, May. Yeah. So I think what you meant is that you make an appointment, you come here, and then then if you decide you want to join, will the price still be 997? I think this 997 is only for now. If you have any question you want to talk to us, I will encourage you to call this number 88794342. Okay, 88794342. Okay, you can ask question and how things are. Okay, don't worry. Any other question? Any other question? Hello? So Valerie is asking, what if my sessions extend to after 3 months? Okay. So so far I have a few patients that after 3 months, right, they still get a bit of problem, and so they will still text me after 3 months. So actually I will still reply the messages. In fact, sometimes they ask me about things, shoulder pain, neck pain. I will still send, teach them what exercises to do and things like that. Okay. So but if after 3 months and if you have any problems, I mean, so far I've not had anything, but if you have problems, right, we can do follow-up in the clinic sessions. We can still help you, so don't worry, we can still help you. So far I've not had any problem, but yeah, if after 3 months, you want more exercises for the knee, don't worry, I can still send you the exercises, don't worry. I will still teach you the exercises online, okay? So what is taught online? So basically, right, when you come to the clinic, the first session in the clinic was for me to have a very, very clear picture of your condition, for me to explain to you, your problems, how to use the devices, what are the right things to do. Okay, then after that, I will follow up with you online to see, or how are things, what are some of the extra exercises that you can do, if you're doing any exercises wrongly. So basically it's a, guide you, coach you, hold your hand and help you recover, right? So basically that's it, Valerie. Very, very value for money, 50% off, 50% off. I offer this heart pain also, yeah. So Esther is asking, I only have little pain getting up after sitting too long. Can walk, but not more than 3 to 4 kilometers. Should I join your program? Yes, Esther. It's better to join the program now rather than wait. Wait until your pain become worse, and then only you join. Right? The worse pain you have, the outcome will be more difficult to treat. Outcome may not be so good. So even though you have only little pain getting up after sitting for too long, it's actually a good time to join instead of wait until it becomes worse. Right? So yes, Esther, you should join the program, and we'll help you. We'll help you with your pain, right? Get rid of the pain, right? Help you to be able to walk longer. Maybe not so much pain after stand up for sitting too long. So Valerie is asking, does the price include device? So again, everyone, the price that I mentioned, 997, is after 50% off, and is the only thing that you have to pay. Right? No extra charges for the pulse electromagnetic field devices, no extra charges for the supplements, no extra charges for the exercise equipment, No extra charges for asking me questions, for for the online session, for the in-clinic session, nothing. Net. Okay. We are not here to cheat or sell magic oil. Okay. I'm really here to help you all, to guide you all get better. Okay, any other question? Any other questions? Okay, I just received an update. So basically only 4 sessions left. Only 4 slots left available. Okay, only 4 slots left available. So if you're interested, I will really encourage you to join early, okay? So if you have, so Valley is asking, is it a portable device? Yes, it's a portable device. It's very light, very portable, very safe to use, very safe to use. I have a metal implant on my right knee. I was told that I can't do radio frequency. Okay, so Mei Wong, if your metal implant that you refer to is your knee replacement, right? No, you can do radio frequency therapy. Okay, we have patient who did knee replacement, put metal because of fracture. It's safe. It is safe. Okay, it is safe. I've done it in the clinic, done it for many patients. Don't worry, okay? Don't worry. You will not be the first patient of mine to have problem. Don't worry. It will not be you, okay? In fact, you're doing it on the left knee, right? You want to treat the left knee, not the right. So yeah, it won't affect your right knee. Don't worry. So yeah, is it a portable device? Yes, it's a portable device. Very light, very portable, very effective, very safe, very safe. Any questions? Any other questions? Any other questions? So if you don't know where to join, you don't know where to click the join to buy the offer, right? You can check your email. We have sent email to you. And yeah, you can sign up via that email. Okay. Any questions? So I'll just give another couple of minutes for if you have any question to ask. Maybe 1 or 2 minutes. Yep. So don't worry. Whatever that we are doing here, I mean, we are a proper physiotherapy clinic. We are registered with MOH. My license is registered. Don't worry. There's I'm not here to sell snake oil. I'm here to just really guide you to get better, right? We have patients from all kind of background, celebrities, normal people. Doesn't matter who you are, doesn't matter how old you are, we will be able to help you. We will be able to help you. Even if you can't recover 100%, you will at least recover 50%, 70%, 80%. Don't worry. Okay? If you have done knee replacement and you don't want to, avoid another knee replacement on the other side, if you have done knee replacement and it's still painful on the same side, you can sign up for this program. So May is asking, if I see you at the clinic later, how much is the price? So it will be a normal price, though. It will be normal price. And if you are not confident on doing things online, what I can recommend is you just come to the clinic for 1 session. You just do that 1 session, right? You just do that 1 session. And yeah, and then you see how from there. If you feel that it's very helpful and you want to, continue, then no problem, right? If you want to know how much is the price and things like that, you can text and WhatsApp the number 88794342 to arrange for 1 session in the clinic. My admin will help you to make arrangement. Will explain to you about the pricing. For 1 session in the clinic, how much will it cost? After 1 session, the next session, how much will it cost? What are some of the, can you use insurance? Can you use MediSave? Can you use insurance? Can you use your any payment options, financial options, things like that? We can help to explain to you. Don't worry. But this offer 997 is only for now. It's only for now. It's really, really value for money. 50% off, right? 50% off. I mean, if you look at some of those very good supplement out there, 1 month would have easily cost you close to $100 really. 3 months, $400. If you join a gym program, let's say you do 1 session once a week, 3 months, 12 sessions is already $1,002, right? So yeah, it's actually very value for money, very value for money. Okay, so if there's no further question, I'm going to end my webinar now. I hope everyone has learned something today. Everyone has, bring home valuable knowledge that you gain. Now okay, when you have knee, you need to see if there's inflamed. You need to see if there's any damage in the joint. You need to see if there's any exercises that you need to do, right? If today, you can do supplement will be able to help, collagen will be able to help you. You know that pulse electromagnetic field device therapy can help you. You know that doing the right exercise is important to you. So yeah, don't worry. I hope everyone has learned something today. Share this new knowledge. Share this new knowledge with your friends and family. Keep this knowledge with yourself so that in the future, if you have a problem, you can bring it out and use this knowledge to help pain. Okay, so bye everyone. Bye everyone. So the offer is still on. The offer is still on. If you want to sign up, click on the email. All right. Just because I closed this webinar doesn't mean the offer has ended. It's still on. Just I think, let me see how many slots left. Only 4 available slots remain. So yeah, I'll just close this now. If you want to join, check the email. Okay. Bye bye. Thank you everyone.